Hi, my name is Lillian Tahan. I am a registered nurse and I work in cardiac and pulmonary rehab at Pascack Valley Medical Center. Working in pulmonary rehab, we see many patients come through the program with a diagnosis of COPD. With this said, I wanted to speak about COPD disease and present steps you can take to live well with COPD. I first wanted to speak a little bit about lung anatomy. The lung anatomy resembles an upside-down trach. So the windpipe or the trachea would resemble the trunk of a tree. The trachea then divides into two large tubes called bronchi, which would be the large branches of a tree. The bronchi then divide into many smaller tubes or bronchioles, which would be the smaller branches of a tree. The bronchioles end in clusters of tiny air sacs or alveoli, which would resemble the leaves on a tree. The alveoli are full of tiny blood vessels or capillaries. So the oxygen in the air you breathe passes into these capillaries and enters your bloodstream. Carbon dioxide, which is a gas and waste product of metabolism, is exhaled out of the lungs at the same time. So you're breathing in oxygen and then exhaling out carbon dioxide. Your lungs rely on the natural elasticity of the bronchial tubes and alveoli to force air out of your body. In COPD, however, the bronchioles and alveoli lose their natural elasticity, making breathing difficult. Chronic obstructive pulmonary disease, or COPD, is a chronic inflammatory lung disease that causes obstructed airflow from the lungs, making breathing difficult. Emphysema and chronic bronchitis are the two most common conditions that contribute to COPD. They usually occur together and can vary in severity among people with COPD. In chronic bronchitis, the bronchial tubes become inflamed and narrowed. The lungs produce more mucus, which can further block narrowed tubes. It's characterized by daily cough and mucus or sputum production. For it to be categorized as chronic, the cough lasts at least 3 months with recurring bouts for at least 2 consecutive years. In emphysema, as we've discussed, the alveoli or air sacs have very thin walls full of tiny blood vessels or capillaries. The inner walls of these sacs weaken and eventually rupture, creating one larger air space instead of many small ones. The surface area of the lungs is reduced, and in turn, the amount of oxygen that reaches your bloodstream is reduced as well. So when you exhale, the damaged alveoli do not work properly, and old air becomes trapped, leaving no room for fresh, oxygen-rich air to enter. COPD develops slowly over years. Often symptoms do not appear until significant damage has occurred. Most patients present with shortness of breath, especially during physical activities, but eventually emphysema causes shortness of breath even while you're at rest, as well as COPD. With both COPD and emphysema, you can have wheezing, chest tightness, chronic cough, which can be productive or non-productive, frequent respiratory infections, lack of energy. In the later stages, you may have unintended weight loss. Swelling in the ankles, feet, or legs can signal a more severe cause of COPD. Swelling happens due to complications of COPD called pulmonary hypertension. And pulmonary hypertension occurs when there's high blood pressure in the blood vessels of the lungs. So right-sided heart failure may develop due to pulmonary hypertension. And blood can get backed up in the veins, and as fluid leaks into the surrounding tissues, edema develops. Fluid starts to pool in the lower parts of the body due to the effects of gravity. So that's why you'll see some swelling. You may see swelling in the ankles, feet, or legs. These symptoms usually worsen over time, be more likely to experience episodes called exacerbations. And this is when symptoms become worse than your usual day-to-day variation, and they can persist for at least several days. Symptoms that aren't improving with treatment or getting worse, you should really call your doctor. And especially if you notice symptoms of infection such as fever, change in sputum color. You should seek immediate care if you're unable to catch your breath. If you notice severe blueness of your lips or fingernail beds, this is called cyanosis. If you notice an increased heartbeat, rapid heartbeat, or if you feel foggy, trouble concentrating. The most significant risk factor for COPD is exposure to tobacco smoke. But pipe, cigar, marijuana smokers and people exposed to large amounts of secondhand smoke are also at risk. If you have asthma and you're a smoker, that increases your COPD risk even more. Only about 20% of chronic smokers do develop COPD. There's also a genetic susceptibility if you have alpha-1 antitrypsin deficiency. About 1% of people with COPD have this disorder. It's a genetic disorder that causes low levels of this protein AAT. And AAT is made in the liver and secreted into the bloodstream to help protect the lungs. So some people can be treated by replacing this missing AAT protein, which may help prevent further damage to the lungs. And long-term exposure to chemical fumes, vapors, dusts in the workplace can irritate and inflame your lungs too, which can be a cause for COPD as well. Some respiratory infections are complications of COPD. So people with COPD are more susceptible to colds, the flu, pneumonias. So it's important you receive your annual flu vaccination. Regular vaccination against the pneumococcal pneumonias can help prevent some infections as well. And of course now COVID-19 vaccine, if you haven't already received that, it's important to speak to your doctor about receiving that vaccine as well. Another complication, we spoke briefly about that before, is pulmonary hypertension. Can cause high blood pressure in the arteries that bring blood to your lungs. Lung cancer, smokers with chronic bronchitis have a greater risk of developing lung cancer than smokers who do not have chronic bronchitis. Depression, people who are having difficulty in their breathing and can't do their usual daily activities that they used to enjoy, may have some feelings of depression that may need to be addressed. So if you have symptoms of COPD and a history of exposure to lung irritants, especially cigarette smoke, your doctor may recommend these following tests. Spirometry is the most common lung function test. You'd be asked to blow into a large tube connected to a spirometer. It's a machine that measures how much air your lungs can hold and how fast you can blow the air out of your lungs. It can also be used to track the progression of disease and to monitor how well your treatment is working. Chest x-ray may be done. It can show emphysema. It can also rule out other lung problems or heart failure. CAT scan can also help detect emphysema and determine if you may benefit from surgery for COPD. It can also be used to screen for lung cancer. And arterial blood gas analysis measures how well your lungs are bringing oxygen into your blood and removing carbon dioxide. Damage to the lungs from COPD can't be reversed, but treatment can help control symptoms and minimize further damage. So when we talk about treatment, smoking cessation is very important. It's the most essential step in any treatment plan for COPD. It's the only way to keep COPD from getting worse. We understand quitting is not easy, but it is important to reach out to your doctor, seek medical advice on nicotine replacement products and medications that might help. Also speak to your provider about ways to handle relapses. If you quit smoking and had a relapse, how you can try to avoid that from happening again. And then avoiding secondhand smoke exposure whenever possible. Doctors may prescribe medications such as bronchodilators. They usually come in an inhaler form. Bronchodilators help to relax the muscles around your airways, can help relieve coughing and shortness of breath. Now, depending on the COPD severity and where you fall within that severity class, the doctor may prescribe short-acting bronchodilators, usually important to take before activities. Some examples you may be familiar with are albuterol, Xopenex, Atrovent, and then the long-acting bronchodilators you're taking daily. Some examples would be Spiriva and Ceravent. You may be placed on inhaled steroids. Steroids help to reduce airway inflammation or swelling and help prevent exacerbation. So they are useful for people with frequent exacerbations of COPD. Examples would be Flovent and Pulmicort. Some side effects to look out for would be bruising, oral infections, and hoarseness. Combination inhalers would consist of a bronchodilator plus an inhaled steroid. An example, Advair, Symbicort, and triple therapy would include an inhaled steroid plus 2 different types of bronchodilators, and a Trelegy Ellipta would be an example of a triple therapy. Oral steroids are usually prescribed for moderate or severe acute exacerbations. They help prevent further worsening of COPD. Serious side effects would be weight gain, osteoporosis, diabetes, and increased risk of infection. And finally, antibiotics may be prescribed to help fight acute exacerbations as well. Azithromycin is a common antibiotic prescribed. So it's important to avoid scheduling your medicines at bedtime if they do prevent you from falling asleep at night. Lung therapies exist for patients with COPD, oxygen therapy being one of them. If there isn't enough oxygen in your blood, you may need supplemental oxygen. Several devices do exist out there. Some with COPD use oxygen only during activities or while they're sleeping. Some may need it 24/7. But it has been shown to improve quality of life and has even been proven to extend life. There's also pulmonary rehabilitation. In this program, a combination of education, exercise training, nutrition advice, and counseling. The staff would provide techniques for reducing or controlling breathing problems for patients, provide emotional and psychological support, work with a variety of specialists. Has been proven to help shorten hospitalizations for COPD patients, increase ability to participate in everyday activities, and improve overall quality of life. But even with ongoing treatment, you may experience times when symptoms become worse for days or weeks. We spoke about acute exacerbations. They can lead to lung failure if you do not receive prompt treatment right away. They can be caused by respiratory infection, air pollution, or other triggers of inflammation. So it's important that you seek prompt medical help if you notice sustained increase in coughing, change in your mucus, or if you have a harder time breathing. You may need additional medications, such as the steroids and antibiotics, and you may need supplemental oxygen or treatment in the hospital. Surgery can be an option for some people with some forms of severe emphysema who aren't helped sufficiently by medications alone. Examples: colectomy, lung volume reduction surgery, endobronchial valve volume reduction, and lung transplant is an option for certain people who meet specific criteria. So it's important that you are in touch with your pulmonologist, and he or she would let you know if you would be a candidate for any of these procedures. So steps you can take to live well with COPD. It's really important to create an action plan with your pulmonologist. Try to set goals that can help you stay on the path to wellness. Quit smoking. If you currently smoke, try to quit. Avoid places where others smoke, and talk to your doctor about programs, techniques, and medications that could help you to stop smoking. It really is the best move you can make to improve your quality of life with COPD. Control your breathing. Pursed breathing and diaphragmatic breathing are breathing techniques that allow your lungs to empty more effectively. So it's important to practice those daily if you can. Keep your lungs clear. Drink plenty of fluids to keep your mucus thin. Thinner mucus is easier to cough up than thick mucus. And speak to your doctor about different ways to help clear your lungs, such as controlled coughing, chest percussion, or postural drainage. And exercise regularly. This can improve your overall strength and endurance, strengthen your respiratory muscles, and talk to your doctor about pulmonary rehabilitation. See if you would be a candidate. Conserve your energy. Take time to rest after bursts of activity. Move slowly to avoid breathlessness. Really try to pace yourself. Eat healthy foods. If you're underweight, your doctor may recommend nutritional supplements such as Ensure, which may have higher protein content. If you're overweight, losing weight can significantly help you breathe better, especially during times of exertion. Try to choose healthy, nutrient-packed foods. Slow down when you are eating, and eat several smaller meals throughout the day. Learn to relax. Feeling stressed and anxious can make breathlessness much worse. Take time to find the best ways to help you relax. And consider meditation, yoga, mindfulness, and/or listening to relaxing music to help avoid stress. I understand working with COPD patients that it can be a challenge. So it's important to talk to family and friends about the adjustments to changes. Consider joining a support group for people with COPD. You could go there in person, or many websites offer online support groups, which is wonderful. And you may even benefit from counseling or medication if you feel depressed or overwhelmed. Triggers are things that can irritate your lungs and make COPD symptoms worse. So it's important to try to avoid these triggers, such as pollution, smog, secondhand smoke, strong fumes, perfume, scented products, even cold, hot, and humid air. Use your oxygen if necessary and as prescribed. If you have a portable system, which is great, this would allow you to run errands, visit friends, even travel while wearing your oxygen. And ask your provider if oxygen use is right for you, and be sure you understand your oxygen prescription. And see your doctor regularly, even if you are feeling fine. It's important to steadily monitor your lung function and stay up to date on your vaccinations that we discussed before. And talk to your provider as well about the COVID-19 vaccine, so that's fairly new. And again, participate in pulmonary rehab if you're a candidate. If your doctor did prescribe it, try to participate. Pulmonary rehab offers many benefits, and we would love to care for you. Hope you enjoyed the presentation. Thank you.